to get in the air and stay in the air and keeps him healthy. He actually gave me my medical, so we're very grateful. He's going to talk a little bit about obtaining FAA Medical Certificate. So give it up for Dr. Hiestand.
This is intended to be a relatively casual conversation. I have a bunch of slides that go over some details, but certainly if you see something you're like, hey, tell me more about that, feel free to interrupt me and I'll tell you as much as I know. And like I always say, if I don't know, I'll make it up. Actually, first I say, ask Jackie. If Jackie doesn't know, she'll ask me, and if I don't know, I'll make it up. So kind of an outline. We'll do some general overview of the medical certification process. We'll try to talk a little bit about choosing the right medical certificate. Everybody always like, well, do I need first or third, or what do I need? And then how do you prepare for the exam? Dr. Northrup, who is our flight surgeon for the current status, likes to say it's pre-flighting your medical. You know, you're not going to go jump in that airplane and take off without pre-flight, and you need to pre-flight your medical, because you need to know there are certain medical conditions that probably won't keep you from flying, but they might require some extra paperwork. And from the standpoint of medical certification, it's much, much, much easier and faster if you come into us and we've already talked about those things that we need extra documentation for, or you're going to need a special issuance for, that kind of thing. It's incredibly uncommon for people to completely not be able to get a medical. Almost everyone will eventually get a medical. There are only a handful of conditions that are going to keep you out. And even those are only going to keep you out for defined periods of time. But we would like to expedite the process if we can. Talk a little bit about MedXPress. Those of you who've done exams kind of know this process. And then there are some common medical and behavioral conditions that could impact medical certification. I'll also talk about some medication issues and that kind of thing. FAA Medical Certification, you know, for the testing purposes, falls under 14 CFR Part 67, and that addresses really the specifics of medically qualified individuals. So I think most of you all use your iPads now with ForeFlight or something to look at CFRs. So go to Part 67, and that will tell you everything there really is to know about health conditions that can impact medical certification. There are some other regulations that are kind of involved, the most significant of which I think is Part 61, and that talks about, you know, when you need certificates, when you need ratings, when you need authorizations. 6123 talks about the requirements and duration, because medical certificates don't have an expiration date on them. You have to understand the duration based upon the class medical you need for flying purposes. And then 6153, I think, is the most important regulation when it comes to medical certification, because that puts the onus back on you as a pilot. If you have a medical condition that makes you unsafe to fly, you have to ground yourself. So people will call me all the time. Hey, what do I need to do? Well, you got to ground yourself right now. You don't get a new medical with me. I'll provide you advice, but medical certification only comes at the time when you need a certificate, and you're responsible for everything else in the interim. And then we talked a little bit about basic meds under Part 68, and I won't talk about basic med today because for the most part, that is really a certification process for folks that are usually a little older and, you know, aren't really flying for hire or wanting to fly for hire. So it's a little bit different. So when do I need certain classes and what class do I need? So it's important to know that a Class 1 medical certificate is really only absolutely necessary when you're exercising airline transport privileges in a Part 121 organization, acting as the pilot in command. So left seat on a UPS airplane flying around the country, you need a first class medical. Right seat as a required crew member in a domestic airline, Part 121, UPS, Southwest, Delta, right seat, most of the time you only need a second class, okay? So though there are some corporate operations that require a first class to sit left seat, And then there are certainly some insurance organizations that will require a first-class medical certificate in order to insure you for that operation. There are some older pilots that get into their 70s and they want to fly their Pilatus. Well, they're not gonna insure you for a $2-3 million hull value without making certain that you're healthy. So. And then for most of you guys, the other circumstances when enrolling in some Part 141 flight schools. So if you're going to go to ATP or EKU or North Dakota, they might very well say you need a first class to matriculate, enroll, start flight training. Some of them will require it before you enter. Some of it will require before you start flight training. So it's really important to ask these organizations before you get too far along the process what they want you to have. Now, for practical purposes, it's kind of dumb. The only thing it does is tell you that yes, you can hold a first-class medical certificate today because you might have something happen tomorrow that keeps you from a first-class medical certificate. So take it with a grain of salt. You got it today. That doesn't mean much, but it's important to have one, I suppose. The biggest thing that will impact particularly males, boys, because it's more common, is color. So you cannot get a first-class medical if you are color deficient. We'll talk a little bit more about color deficiency. It used to be somewhat easy to get a waiver for that condition. That changed about a year and a half ago. And now it's very difficult if you cannot pass any of the color vision tests to get a waiver for that. Class 2s are basically acting as a pilot for hire, any other commercial operations. Most commercial pilots outside of Part 121 carriers, ag, banner tow, that kind of thing, are fine with a Class 2. And then a Class 3 certificates when you're, operating as a private pilot or even in a Part 61 flight training program. So the process, for those of you who haven't been through it, real quickly, schedule an exam with a medical examiner. You can use a senior AME. That typically a senior AME is someone who's been an aviation medical examiner for 3 years or more. A AME, not with the senior classification, is someone who's relatively new, typically in the first 3 years of being an AME. It doesn't matter that they can issue the same certificate. A first class, though, has to come from a senior AME. So if you feel like you need to get a first class, you've got to see a senior AME. If you can do with a second or a third, you can use any AME. Examiners are located using the AME locator. That's a pretty quick Google search. I do recommend folks use the real FAA search engine because there are a bunch of other ones out there that aren't always accurate. Fees do vary from examiner to examiner, so if cost is a significant factor for you, call around, ask what people charge. Used to be you could get, when Dr. Schulteis was around, you could get a medical for $100. I think the $100 medical went away when Dr. Schulteis passed away. And they won't tell us what the, standard rate should be. They'll only tell us that we don't charge enough, usually. So call around for that. Medical history has to be entered into MedXPress. So everyone needs a MedXPress account when they start. It's a good idea to do that under not an academic account, not your parents' account. Get you an email account, Gmail, AOL, Yahoo, whatever, something that you can keep forever, because that login ID lasts forever. That you don't want to change that. If you wind up changing your account, so you get a medical under one account this year, and then you don't get another medical for 5 years, and you do it under a completely new account, that throws up a red flag in the system. Hey, they're trying to hide something from us. So make sure you try to keep that account, going throughout your flying career. You do need to enter all significant medical conditions that have been previously diagnosed. It doesn't matter if it's resolved. So, a common one for some people would be, ADHD. Well, I had ADHD. It was treated from the time I was 7 to 10, but I don't have ADHD anymore. Well, you did have it. It says, have you ever in your lifetime been diagnosed with? And so you do need to be fairly diligent about putting down everything. The reason to be diligent early on and always is there will come a time when you're going to have something happen to you from a medical perspective for which the FAA wants to review those records. So they're going to ask to see the documents that are in your file. And if you've got conditions in there that haven't been disclosed, boom, they're going to be asking you about that immediately, okay? And that's going to get you a letter. The letter's going to sound really mean. It's going to sound like you're going to jail. It's written by lawyers, of course. But they're going to be asking for information in a fairly expedited fashion. So my take home is, tell me everything. I'll help you with it, or tell your AME everything. And then it also asks for provider visits. Everybody always asks me, well, do I need to include this? Do I need to include that? Provider visits for the past 3 years really should be anything of clinical significance. So you don't have to put down the dentist visit. You don't have to put a routine eye exam down. If you got your flu shot, that's probably not that relevant. But if you went to the doctor for a routine health check and, they prescribed you some medicine for allergies or something, yeah, put that down. So, okay. The physical examination, really is to entail, anything of aeromedical significance. We're not going to do a breast exam for girls. We're not going to do genital and rectal exams. That's not relevant to aviation safety. But we are going to pretty much do everything else. There's going to be at least a perfunctory neurologic exam. Can you walk up the steps? Can you not fall down? Can you stand up straight? That kind of thing. Vital signs. Color vision. Color vision is the tricky one because now, as of January 1, 2024, I think, you do have to do color vision on the first exam. You don't ever have to do it again if you pass, but you do have to do a fairly detailed color vision exam. There are 3 approved testing modalities for color vision. Wagoner is something that you can do on a iPad or a computer, and that's the one that we have. Wagoner is the one that most AMEs use. Ray-Ban Cone is another alternative. There are virtually no AMEs with that piece of software. The reason is it's about $15,000, so nobody has that. There is a place, if you can't pass the Wagoner, there are a handful of people that can pass Ray-Ban Cone, and there are a few of those around. There's an ophthalmologist in Ohio that has one. There's one in London, Kentucky that has one. So we can give you a reference to that. The last one is called the Color Assessment Diagnostic CAD test. You'll have to go to Europe for that one if you want. So from a practical purpose, you have 2 color vision assessments that have to be done here. If you do them in my office, I promise you that we have done all of the testing and validated that all the settings are correct for the device, because you do have to do some special settings. If you do it with another AME and can't pass it, make certain that they have validated all the settings, the true tone, the night shift, all the things that can throw that off a little bit. Okay, so that's color vision. You have to pass that once. Once you've passed it, you never have to do color again, okay? Distance vision is checked either through a wall chart or through a Titmus vision checker. You do have to be 20/20 in both eyes individually and binocularly to get a first-class medical. Near vision's 20/40, both eyes. Intermediate vision's checked after you're age 50. That one is also 20/40. For those of you who are filling it out, there's question 17B that will come up. And at 17B asks, do you wear near vision contact lenses when you fly? None of you guys use near vision contacts. These older folks might. But near vision contacts are contact lenses to see close up. A contact lens to see your iPad, and a contact lens and your other eye to see distance. You cannot do that from the FAA's perspective. So when you see 17B, if it asks about contacts, it doesn't apply to you all. It's really asking about near vision contacts. Your AMEs will note any scars, surgical scars or otherwise, tattoos. Maybe you guys don't have any tattoos yet, body markings, that kind of thing. You do have to do a urinalysis when you come in. The urinalysis is just for glucose and protein. So don't freak out. Everybody always kind of gets worried about doing a urinalysis for some reason. It's pretty simple. Make sure you hydrate before you come in, that kind of thing. And then you do have to anytime you go to a new AME, you're supposed to show proof of identity and age, because we're not going to, certify that we did an exam on your cousin. What if you can't pass the color? Well, color vision is important because, you need color, particularly in these, new displays that people have. If you can't see colors properly, you're going to have trouble. So there is a good reason to assess color and make certain that you can see. This change came about as a result of a FedEx crash in the early 2000s that resulted, at least in part, from a color vision deficiency. And a pilot who had passed the operational color test, which is what we used to do, get in the plane, go out, have the tower flash the lights at you, you see the colors, you're fine. That guy had passed it, but they felt that the crash was related to color deficiency. Anyway, used to be that it was relatively easy to get a waiver. These days, you got to find a way to pass Wagoner or Rabin Cone, or we can fill out one of these forms and say, I can't pass anything. I really want a medical with first class. I haven't seen them approve anybody yet. That goes to the surgeon, the flight surgeon in DC, Dr. Northrup, and I haven't seen her approve anybody yet. Dr. Wyrick, her deputy, actually does it, and he's pretty much said he doesn't feel like there's going to be any reason to create any other alternatives, at least for now. Now, maybe there'll be a new test that comes about, but for now, that's pretty much where we are. So the FAA medical certification process is absolutely not a secret. There is everything out there that I use is freely available on the web. It's not behind any firewalls or password protected or anything. This is the current FAA AME guide. You'll always want to look up at the top and see when it was last updated. Try to use the most recent version because it changes every month. Every month I got to go make sure something didn't change again. Something changed that's a couple slides, a couple months old, but something changed in April. And I'm like, oh, for crying out loud, I can't keep up with all this. But they'll tell you in there what changed if you're interested in diabetes. So for younger folks, diabetes not very common unless it's type 1 diabetes. But if you do have some issues with weight, if you do have an elevated hemoglobin A1C, as long as it's at or below 6.4, you can be certified. That just means you bring documentation to me, we talk about it, and we get you certified. If you truly have diabetes, which the FAA classifies as a hemoglobin A1C of 6.5 or greater, that does require a special issuance, but it's relatively easy to get folks certified. Doctor notes, last A1C, medicines, piece of cake. They'll certify you in no time. Type 1 diabetes. Type 1 diabetes is a very labor-intensive special issuance. It usually requires continuous glucose monitoring. It requires a ton of data from that device. I have one patient, I think, that I started with that. He finally got it. And one that I follow with that. It's just a lot of data. It's a very expensive special issuance to keep up. So if you're a type 1 diabetic, we can probably get you flying, but you got to be very vigilant about maintaining your glucoses in the range because they won't let you be out of range and fly. Weight loss, pre-diabetes, that's what we call a CACI. People ask about weight loss medicines these days. You can take weight loss medicines. The GLP-1s, Wegovy, those kinds of things are allowable. They just require a tiny bit of paperwork, but you can take those for sure. PCOS is called polycystic ovary syndrome. It's for the ladies. It's usually going to be associated with having a little extra weight, having irregular menses, glucose is a little elevated. Again, this is a CACI form, and we can get you certified for that. Another not common, but another issue that we'll run into from time to time with younger folks is heart conditions that are, you're born with, so congenital cardiac lesions, valve disease, not uncommon to have sports physicals. Oh, you got a murmur. Oh, the murmur shows a bicuspid aortic valve. The FAA is going to want more information about that. Arrhythmias, it's rare to have an arrhythmia. That's when the heart is not beating in the normal fashion, but it can affect younger folks. Cardiomyopathies are when the heart gets either loose or stiff, and those can affect younger folks. And then syncopal offense is the big one that affects folks in your all's age range. Passing out. That one, can frequently require a fair bit of evaluation through, monitoring, heart rhythm monitoring, doctor notes, that kind of thing. Now, if you got dehydrated and you're out running 10 miles and you passed out, okay, we can probably deal with that. But anything else that has, any concern for a condition that could be related to the heart or neurologic symptoms is going to take a little more time. So, head injuries. Are kind of a pain, sorry. So even concussion, so, you're playing sports, went out, did soccer, had a concussion, or football, had a concussion. There is a wait time on a concussion. So I always tell people that, our professional pilots, stay off the dirt bikes, stay off the, things that are going to get you bonked on the head, because I have more than one UPS pilot who, doing silly things, was out for 6 months because they got to wait the amount of time. So it is a 6-month wait period with a concussion. You do have to have doctor notes. I do have to defer. So if you look in the guide, you'll see where it says defer. I don't have any choice in that. I have to send that stuff to the FAA, and they will issue your certificate, which means it's going to take some time. Not a lot usually. Severe brain injury. Again, I got a couple of younger folks with that. Had a little bit of blood in the brain. That's a 5-year wait before you can go back to recertification, and a lot of paperwork. You got to go back and see the neurologist. You got to have an MRI. You got to have an EEG. It's a lot of work. So don't do stupid stuff when you're young, on purpose anyway. Essential tremor, kind of when you shake a little bit. That can happen with younger folks occasionally. Becomes more common as we get older. But essential tremor is fairly common, and it's a condition that usually I can issue a certificate as long as I have the right amount of paperwork. Depression and anxiety. Okay, so this is unbelievably common in our society and our healthcare system. It's very common because doctors, this is my soapbox, doctors don't have much time to spend with you if you're feeling like you're blue or gloomy or got some anxiety about school or something. So they immediately reach for a medicine, and they immediately cure you in like 5 minutes or less, and they don't have to talk to you. And most of the time that's not going to be a serious issue. It's just going to be something that you treated with medicine, and most of the time you get better and you do great. But it does require us to do lots of paperwork. There are some instances where isolated short-term situational depression or anxiety, went to a new school, was anxious about that, lasted until you got comfortable with the school and got better. Those kinds of things usually we can document. But prolonged bouts, usually anywhere from 6 months to 2 years, that's going to require the FAA kind of look at that documentation. Most commonly, doctors will write down major depressive disorder. Most people don't have major depressive disorder by criteria, but it codes to a way that gets them paid, and so that's what they diagnosed. Depression or anxiety with any suicidal ideation or other mental health conditions or certain treatment modalities really gets into the realm of the special issuance piece. The AME always needs to look at records, so please don't come in and say, "Oh, I had anxiety a few months, and I'm all better. I'm fine." I got a lot of moms that do that. That's not enough. I understand that you're better, and I'm grateful for that, but I have to put into the record the documentation. If I don't, they're going to turn around and ask for it from you, and I'm going to get dinged, and you're going to get another letter that looks like it was written by a lawyer, because it was. But this is the tool I have to use. So again, there's a tool that I have to document to get through all these things, and I have to make certain that I'm documenting appropriately, or they're going to ask for more information from us. Most of these are going to be no's for most of you guys, because again, it's going to be short term, not a big deal, that kind of thing. But if you do have major depression or major anxiety, you've been on medicine, that's okay. Again, it's usually a special issuance, but Any of these conditions, I think there actually may be a few more. You have to be on medicines for at least 3 months at a stable dose. So that's the key. So if you've been on medicine for 3 months at the same dose, then we're eligible to kind of start the process and work through it. So there are medicines that are specific in that realm, and we got to make certain we get you on the right thing. So if you're taking something, just let's work on making sure we're on the right medicine. You do have to have monitoring by a psychiatrist or a HIM psychiatrist, and then you do have to have neuropsychological testing. If you are in the path of anxiety or depression and you are on a medicine that you want to continue taking, the cheapest path is to find a prescriber who is also a psychiatrist. You still have to do the neuropsychological evaluation at the beginning, but your psychiatrist can write the notes. They're templated out. I have to give you the format that they need to write the note, but they can write the note, and more importantly, once you get your special issuance, you have to do that every 6 months. I can only write you a certificate every 6 months if you're on one of these medicines. So the fewer doctors you have to go to, the cheaper it is. So ADHD, there are 2 tracks now, but the magic number is 4 years, okay? So there's the fast track and the regular track, and 4 years is the key, okay? People will come to me and say, well, I was diagnosed, but I was never treated. It does not matter if you've taken medicine or not. If someone wrote in a clinical progress note within the last 4 years, ADHD, you cannot go through the fast track. You have to do the regular track. If someone writes in a note, ADHD diagnosed 6 years ago, don't have symptoms anymore, that would make you eligible for the fast track. But it can't be a diagnosis in a medical record stating it as a current problem or a current evaluation within the last 4 years. There's a process. This is in the guide. You can kind of look at that to see what the fast track would involve. The fast track allows you to see a non-HIMSS neuropsychologist to get your workup done. And what that would mean is if you had a psychologist or a neuropsychologist that saw you maybe 8 years ago, and they are willing to see you again to do some documentation, it's probably going to be a cheaper process because there's less involved. You don't have to go through all the very specific tests that are required if the window is 4 years. So if you have questions about that, talk to us about it, and we can help you because there are some psychologists around here that can do this. If you do have to go to a more of a HIMSS trained neuropsychologist, there are fewer of those around. I would not say this to in public forum, so hopefully it's not terribly forum. I would not use a neuropsychologist that's practicing in Louisville. There are some folks that do this in Louisville, and they tend to have offices in lots of places, and I don't think they can dedicate the time like maybe they should. There are some very, very good neuropsychologists, and one of them is in Lexington, Kentucky, and he's pretty easy to get into. There are some others too that Jackie and I can help you with. I think this kind of goes over all the evaluation, documentation, that kind of thing, just as a general format. These are the kind of records, though, that you will need regardless, okay? You need pharmacy records for the last 4 years. So go to your pharmacy, tell them you need all, and if you use multiple pharmacies, you need from multiple pharmacies. All the medical records that are related to that diagnosis. So you've been seeing somebody for 8 years, you need all the medical records that include that. Any other evaluations that might have been done, if you had psychological testing done by, someone in the community or a therapist at school or whatever, you need that. Medical records related to any other condition. So that's important too. Driver's license if you have one for 4 years. Academic records, and then there's a very specific template for a personal statement that you need to write yourself. Personal statements need to be a letter, it's addressed to the FAA, it's dated, it's signed, and it goes over all the questions that they, when did you were you first diagnosed? What were your symptoms? How were you treated? When did it get better? How do you do now? That kind of thing. I have that template for you if you need it. HIMSS AMEs, again, those are very few and far between. They do have some additional training requirements. We have to go for training for HIMSS issues every 3 years. It is absolutely required for folks that are in the substance abuse or dependence tracks of special issuance. Currently, it's required for the depression and anxiety track. I don't know that that will be the case forevermore, but it currently is. There are unfortunately only 2 HIMSS AMEs in the state of Kentucky. Me, sorry, and Dr. Villegas in Northern Kentucky, who is not accepting any new patients. So I meant to look in Indiana, but I don't think there's anybody in Southern Indiana for sure. There used to be someone in Bowling Green, but he either retired or dropped the HIMSS certification. Dr. Wells sometimes is still listed as a HIMSS AME. He's not doing it right now. Medical records, just an overview of medical records. If you need to produce medical records for me or for any AME or the FAA, it needs to be complete notes. Can you get them out of my chart? Yeah, as long as you get them printed out properly and they look good. Previously, the FAA would take a letter from your doctor. Hey, Johnny's okay to fly, don't have any issues. They will not accept that anymore. It should be relatively recent note. The FAA is usually going to say within 90 days. For khaki conditions, we want it to be 90 days. The FAA will ask you if they're asking for records for it to be 90 days. The FAA is very specific on requests. So if you get a letter that tells you what they want, that's exactly what they want. You can call me and I'll help you with it, but I don't know any more than you do, and they want exactly those things. I cannot tell you how many folks I have in my system right now who are waiting for a special issuance, and they simply haven't provided the items that the FAA has asked for. They will not review a case until you've provided them everything they've requested. So try to read carefully and take heed of what they're asking for. Like I say, most of the AMEs will review that stuff for you. We can upload it in the new system. If I did your exam and they come back and ask you for information, the letter will say mail it to this address. But we can upload it to your exam and it'll be a little faster. There is a format to what a medical record looks like, a clinical progress note over on the green side. Doctors know what a medical record is, what the progress notes are. Staff people sometimes don't. Medications come up a lot. Can I take this medicine, doc? Happy to help you with that. But this is pretty freely available out on the web. The AMAS group, which is a pilot advocate group that does aviation medicine for lots of organizations. I think they might do maybe their American Airlines is consultant. But they have a website that you basically can put any medicine in there and it'll tell you allowed, not allowed, allowed with the special issuance, that kind of thing. There are a number of medicines that you cannot fly with and we cannot issue. So there's a bunch on the list. Most of the time, these are things that you guys wouldn't be taking. Here's the key, and I think I'll talk about this again in a minute, but medical marijuana, even though we're not in a state with true medical marijuana yet, any marijuana is federally illegal and not allowed to fly. So if you move to Colorado and doing flight training there and somebody tells you you're taking medical marijuana for your glaucoma, don't do it. None of the medicines, unless they're on the list, are allowed in the behavioral health conditions. And then a lot of the weight loss medicines aren't allowed. One thing that comes up is you get a cold or an allergy or poison ivy or something and you're given steroids. Prednisone is commonly used for steroids. Has to be less than 20 milligrams a day. So a lot of times you'll get a Solu-Medrol dose pack, or Medrol dose pack rather. Call me and I'll give you the conversion for that. It's usually 3 or 4 days and then you can fly again. Antihistamines will get people in trouble. The most common medication in aviation accidents identified is Benadryl. So do not take Benadryl and fly. You really need to wait 3 to 5 days before you take Benadryl. But there are lots of acceptable medicines. Again, these are in the guide. So Benadryl is an absolute no-no, at least 60 hours. Zyrtec and Xyzal, these get sold over the counter as non-sedating antihistamines, but they do have a little bit of sedating property, so you want to avoid those within 48 hours. Unisom, some of these other ones are pretty long half-lives as well. The key to that equation is, I may have this on the next slide, is basically 5 half-lives. This is out of the guide, so if you're taking over-the-counter medicines, look what's in the active ingredient. I mean, if it's chlorpheniramine, that's an antihistamine. Don't take that, okay? Read the label. How often do you get drowsy? Read the label. How often should you take it? And wait at least 5 dosage intervals. So if it says take it every 12 hours, 5 dosage intervals is 2.5 days before you should fly again. So some rough calculations. Yeah, see, I told you already. Controlled substances, you cannot take marijuana. You cannot take CBD. Don't do this. I have one pilot in the HIMSS program with me right now that wasn't using marijuana, but his wife was giving him this CBD cream for muscle aches. A lot of CBD creams do have some THC in it, and if you use enough of it, you'll pop a positive on a DOT drug test. You pop a positive on a DOT drug test, you don't lose your medical license, you lose all your licenses. So you got to go back and become a private pilot again, an instrument-rated pilot again, a commercial pilot again, an ATP pilot again. That's going to cost you $100,000. Don't use marijuana, CBD, anything like that. That's a DOT drug test, and most of you, until you start working, won't take that. But I cannot emphasize enough, stay away from that. DEA Schedule 1 drugs are also not allowed, so anything on that list. Kratom people are testing for. Even so, the Schedule 1 stuff is all illegal anyway. But even the Schedule 2 and 3 drugs usually aren't allowed either to fly for sure. What if I lose my medical certificate? My dog ate it. I can't find it. I got my check ride tomorrow. Come on. Mr. Kuiper's going to give me my check ride. He's going to make me see my medical certificate. I can't get you another one. You have to get it from the FAA. That's just all there is to it. You have to be carrying the paper wet signature copy, and there's no way for us to get you one. You have to. There's a website, but you can go to the FAA. You pay them $2. That's a giant pain in the butt. They send you a letter a couple weeks later that says, "Hey, you're irresponsible. Don't lose this again," and so forth. So don't lose it. If you do, you gotta reach out to them. This is the southern region. Dr. Angelisi is our regional flight surgeon. I can't remember who the regional flight surgeon for Great Lakes is. That's Indiana if you live in Indiana, but I can get you that if you need it. But you can always reach out to them if you have anything. If they're ever asking for anything, they'll put the mailing address on the list, but you can do that. And that is all I had for prepared talks. So let me stop talking and see if you guys have questions. Too much, too little? Anything you can think of? All right. Everybody got a medical so far? All right, good. All right. Well, if you don't, usually I say there's really no reason to even try to get a medical until you're at least 16. If you got some health conditions that you want to talk about in terms of the process, certainly we're happy to talk to you before that, but there's really not much reason to try to hold a medical until you're, within a few days of your 16th birthday. Like I say, you could get a medical, today and wouldn't be eligible for it tomorrow, so save the days of flying. I also tell folks really don't come in and get a first class every year. If you're 16 or 17 or 18, you can fly under third class privileges. Save that money for the airplane, gas, buying your instructor something nice, something like that. But, all right. Yes, sir.
How long is a medical good for?
So a medical is good, it depends on your age, but a medical is good for third class privileges under age 40 for 5 years. And they go from the date you were issued, the end of that month. So if you had your medical today with me, May 16th, I think today's the 16th, May 16th, 2026, your third class privileges would be expire May 31st, 2031. Okay, so that's if you're under 40. For you guys, a first class medical privilege expires after a year. So first and second go for a year until you're 40. When you go over 40, it gets a little more complicated. First class is only 6 months. Second class is only good for 1 year. Third class is good for 2 years. So,
If you have first class and then you get a heart attack halfway through your period, and can that get taken away, or do you still have that first class?
So you're holding a certificate, but you're not eligible to fly under 6153. You know you have a health condition that is going to cause you to ground yourself. And then you'll have to go through the process to get a special issuance, because that condition requires a special issuance once you've met the required timelines. So, heart attacks aren't really relevant for most of you guys, but usually it's going to be at least a 3-month wait until you can be eligible again. And there are a lot of very specific tests that you have to go through. So, same thing with, going on a medicine for depression. Hey, I'm having a tough time in school. I need to go on medicine for depression. That's cool. Don't fly. Let's get you on medicine. Wait the 3 months. Get the testing that's done. We'll get your application in. So these days, a new application, so you come in, we got a new condition, we got a new application. If I have everything that you need to get you certified, I do your exam, upload everything, it can usually be done within a month or two. That was not the case 2 years ago. It would take months and months and months, but they're moving pretty fast as long as we've got everything they need. Yes, sir.
Yeah, so, if I have no problems, I just schedule something, do all the tests and exams, how long would it take to get your third class?
If you have no health problems at all,
Let's just say nothing.
you're completely healthy, never been on any medicines, never taken any, had any surgeries.
For the normal, the normal person, how long would it take, if I did all the exams, like a same day thing to get it or something?
So yeah, if you have no significant health conditions, allergies, you take some Claritin, you will get a medical while you're sitting there. We print it out, I'll sign it, you'll sign it, I'll go over my spiel with you, you'll walk out of there with a medical certificate. Yeah. Yeah, it's only when you have health conditions that require some other documentation. And again, for the khaki conditions, some of these conditions that require a little bit more paperwork, if you bring me that paperwork in ahead of time or at the time of your exam, you'll still get a certificate the same day. I have 14 days from the time I do your exam to acquire the necessary paperwork. And if you can get me everything that shows that I can issue the certificate, you can still get it. I have to submit your exam within 14 days of doing the exam, though. So that sometimes will require me to defer it, which again is not a huge deal. If you're going to have the paperwork, it's just that you got to wait for the FAA to send you a certificate, which can take a few weeks. Yes, sir.
More of a personal question, but are you a pilot?
I am, yeah. So I have a private pilot certificate. I haven't flown much because my instructor's been out for a while, so I got to talk to him about that. And one of my partners in the airplane has it in Maryland, but yeah, I'm perpetually working on my instrument rating for the last 10 years. So.
I get this question a lot. It is, I'm a 16-year-old. I want to be a UPS pilot, or I want to fly for the military first to get experience. Do I need to get a first class medical? And I've always kind of leaned the way you say, and that is just get your third class trained. But then, I didn't have one until 48 years old, first class. So during that time, I had rigorous medicals for work, so I didn't really have to worry about the things that you might worry about. Mm-hmm. So is that the guidance is third class? I love that. Third class, use that for fuel.
Yeah. Yeah. There's, again, unless you're going to a school that requires a first class, third's fine. If you're worried about because the only physical characteristic, the only physical exam finding that differentiates a first from a third is the vision. You have to have corrected vision to 20/20. And there are a few folks out there that cannot get corrected to 20/20. That's going to keep you from a first class. So if you have any concerns, my other statement is, don't use the FAA as your screening program, okay? If you think there's something wrong with you, go to your doctor. Don't come to me and have me write down, I can only get you corrected to 2025. That limits your certificate ability. So go see an eye doctor. What does it take to get me to 20/20? Is it possible? So yeah, get the third class, but then make sure, hey, yeah, I can get to 20/20 and I'll be fine. So, yeah.
Do most of those flight schools require a class 1 for insurance purposes? purposes? Is there some
I don't really know why it's. My theory is they want to make certain that they're not training you for professional pilot privileges, and then have you come back and say, I couldn't get a first class medical, I'm going to sue you for training me. They just want to prove that you can hold one before you waste all the money and then try to sue them. But there may be another reason for that. That's just my cynical thought of why they do it. Because there are a few people that come to me and say that ATP requires you to keep a first class medical. I don't think that's really true. I think that's their misunderstanding of it, because not everybody does that. But there's no reason behind that. There is no reason for you to hold a first-class medical while you're doing anything other than acting as pilot in command, Part 121 operation, or another organization. Yes?
Is the color test only done for first class?
No, color's done for everything. Everything, yeah. But you can only get a first class if you can pass color. If you can't pass color, I have to give you a third class certificate with not valid for night flying and not valid, and only valid for VFR. Only valid for VFR and no night flying. That's not the words, but it's something like that.
I just was wondering, because if you got the third class and then you go for first class and you can't pass it, that would be disappointing.
Yeah, no,
I was just making sure that screening was done early.
Yeah, no, that's done on the first exam now. And again, the only difference, the only thing I'll tell you, if you come to me and say, I'm going to do a third class, I'm going to need a first class eventually, what do I need to do? Go to your eye doctor and make sure you can be 20/20. Yeah, 20/20 and 20/40, but most people don't have trouble with near vision. Yeah.
Does LASIK keep you from getting?
No, LASIK is perfectly legal, so is PRK. Be aware that there are some people who get LASIK that have significant side effects. Halos, problems with night vision, that kind of thing. Those kinds of things would keep you from flying until they're corrected. And then some people get LASIK and can't get corrected to 20/20. The magic of LASIK is you have to have a cornea that's thick enough for that laser to be able to reduce what it needs to reduce and still have vision. If you can't do that, if you're questionable, don't do LASIK, because you're gonna wind up with a lens implant or something so that you can get vision. The other thing is I don't know why some people do this, but some people forego LASIK and get an intraocular lens. If you're going to do that, talk to me, because that's got some specific documentation requirements as well. On LASIK, try not to get LASIK, tomorrow and come to see me Thursday for an exam. They need 30 days post-op, so make sure you've had some time to heal. Usually you walk out of there and you can see fine. I mean, I had it 28 years ago, and for 20 years I was perfect and was perfect the day after I was done. So.
What are the specific documents that you mentioned for people who have cataract surgery and have intraocular lenses?
So the cataract protocol changed a couple months ago. So right now, if you've had cataract surgery and it's been more than a month or more than 3 months, we don't need anything. You just have to tell me that you did fine. I do need to know what kind of lens you got, because if you got a multifocal lens, basically one where you don't need reading glasses, you do have a 3-month wait on flying, and I have to have the documentation on that lens to submit to the FAA. But it used to be we had to submit an 8500-7 on everybody after cataract surgery, and we don't have to do that anymore. So again, most of the time now, hey, if you're going to have cataract surgery, wait 3 months, come see me. We probably don't need anything. All right, yes, sir.
Talk a little maybe about scheduling. Do you need any recommendations? Because we've seen this in the past where time crunch comes.
Yeah. Well, I mean, I can certainly speak to my practice. There was a time when it was a little bit difficult to get folks in. I was trying to take care of all the professional pilots in the first 3 weeks of the month. They have to have a medical by the 20th. So if I'm out of time, I can't really, kick those guys to the curb because they can't work. So I, for a long time, was trying to do most of my student pilots closer to the end of the month. For my practice, I'm in the office pretty much every day now, so I can usually get people in within a week at the most. Unless I'm out of town for a week, that's the only time. But Jackie can usually tell you. And if you've got some urgency, call me. I'll get you in. We'll go do it on Saturday or something. I mean, I don't do that unless there's a real need. I mean, but if you've got if you got something you need a medical, I'll make it happen. So, sure. All right. Anything else? All right. I left a few cards up here. I think everybody's got my phone number, and it's there. That's my email. Jackie's email is jackie@looflydoc.com. So if you need her, she's easy to get to as well. Jackie knows all the answers, so anything you need, she can tell you. And like I say, if she can't tell you, I'll make it up. So, all right. Thank you guys for letting me talk.
Thank you.
Oh, thank you. That's very kind of you. Wonderful. Oh.